Hi, everybody. My name is Melanie Escher, and I'm with the Arizona Telemedicine Program and the Southwest Telehealth Resource Center. Thank you again for joining us for our webinar series today. Of course, with the University of Arizona, we respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples, and today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the Autumn and the Yaqui. The Southwest Telehealth Resource Center represents Colorado, Arizona, New Mexico, Nevada, and the Four Corners region, with a combined total of 72 recognized tribes. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. All right, again, so welcome to today's session. The webinar tips and notes, of course, your phone or your computer microphone was muted. We are going to be using the chat feature. So if you have any questions for any of our presenters today, please put it in the chat. There's also a post-webinar evaluation. This evaluation is so important because the topics for today, those ideas came from those evaluations. So things that you guys want to hear about, this is what we're doing. So please be sure to do that evaluation at the end. CME credit is also only available during the live presentation, and everybody that attends, you can also request your certificates, especially for our EMS folks. Welcome and thank you for following our series. So the continuing, these are the outcome objectives, accreditation, and disclosure. This was sent in an email to everybody that's registered, so I'm not going to read through it. And of course, our standard disclaimer, the opinions are of our presenters. This is also being recorded, so be sure to check the website for the upcoming webinars. In fact, Dr. Klotz and I were talking about what's going to be coming up in July. So please be sure to watch our website, and I, of course, will be sending out emails when we get those dates ready for us. So again, this is the evaluation link. It will pop up behind your system, but I will also put it in the chat a little bit later. So without any further ado, I'm going to introduce Dr. Klotz to our Envenomations, Intoxications, and travel-related diseases, which are more common than you think, and what to do. Dr. Klotz, I'll let you introduce our presenters today.
All right, thank you very much, Melanie. Yes, we've got two excellent speakers today, one of whom you've already been acquainted with if you've been following this series, and one of whom is joining us for the first time today, and that's Daniel Massey. Both of these speakers, Massey and Larry York, are PharmDs or pharmacologists and / pharmacists. They are amazing fellows, and I wish you could meet them in person. You'd be quite pleased to know how fantastic they are at doing their work and just making everything work for patients. Now, of course, Dan is all dressed up for his topic, as you can see there. Larry looks kind of like Chris Christopherson with either a vest or a leather jerkin on. I'm not sure which, but he looks better than Chris Christopherson. Okay, so today we're going to talk about two particular topics, which they all fit in this 14 lecture series that we're going to present, or it's probably going to be longer. And they're all going to be archived on the Arizona Telemedicine program website. So you can get at them anytime you wish. And here are some pictures of ones we've already presented. And some of the topics there, plant and animal poisonings, bites, and a whole list of topics of various types. And we'll eventually get to what you see on this slide. Today, actually, we're going to look at the one in the right upper hand corner here. And we'll start off with Dan, if you want to go ahead and introduce your topic and get going, that'd be great.
You got it. Well, thank you very much, Dr. Klotz. My name's Dan Massey. I'm the curator of venomous reptiles at Arizona Poison and Drug Information Center. There we go. And a pharmacist here at Banner University Medical Center, but my passion is definitely venomous reptiles. So on the screen here, you see a picture of a Gila monster. This is one that we have on display over at the Arizona Poison Center. We work in conjunction with the Arizona Game and Fish. These are protected animals. They're in, so they require permits for all displays and captivity. So yeah, this is one of our display animals, and it's going to be my talk. It's called Our Local Monster, Venom and Envenomation of the Gila Monster. There, almost, no.
Back.
There we go. So Helodermatidae is the family that these reptiles are a part of. The genus is Heloderma. Heloderma is a Greek word. Two of them, helo means studded or head of a nail, and derma, of course, is the skin. So it's studded skin. You can see by both these pictures, the one on the right, the head, it has these kind of beaded look to his head, along with the body of the one on the right. You can really see the skin here, how it has this beaded look. So the Gila monster here, the one that we have in the Tucson, Arizona area, is called the Gila monster because it was discovered in the Gila River Basin in Arizona and New Mexico. But the species that are south of the border are nicknamed beaded lizards because of this. Now, these aren't scales like you typically see on, say, a snake, lizards, or maybe in fantasy movies of dragons and whatnot, where scales overlap. Those scales are made of keratin, kind of like our fingernails and whatnot. These are called osteoclasts. So within each of these are bones. So these are actually filled with bone and will show up on x-rays. So they're very different in that manner. We have 5 species of Heloderma. We have Heloderma suspectum, which is our local monster. Then we have south of the border, Exasperatum, Horridum, Alvarezi, and Charles Bourgardi. This is a picture of poster on my left that I've had for many years. And what's funny about this is the taxa of these animals constantly change. So there used to be 2 species of Gila monsters. They were considered subspecies of each other. The top one was from the northern range of Arizona here. The bottom one, called a reticulated, was kind of from most of our range here, but these are now considered one single species. So it's just Heloderma suspectum. These other 4 used to be subspecies of each other, and now they're elevated to full species. So these are the 5 species. So we have the Heloderma suspectum, or the Gila monster, the Exasperatum, the Horridum, the Alvarezi, and the Charles Bourgardi. They all come from the west coast of Mexico all the way down into Guatemala. So some of the background of the Heloderma. Heloderma horridum was first described in 1577. In the late 1800s, our local monster was described by Cope, and it was given the Latin name Heloderma suspectum. At the time, these animals were suspected to be venomous. They weren't sure, so that's where they came up with that Latin name on it. Always found that pretty cool. And even decades later, in 1907, they were still publishing incorrect data stating that this reptile was non-venomous and the bite was innocuous, which I'll show you later that this is obviously not true. In 1913, a gentleman named Loeb did extensive studies with the venom and really proved that this animal was venomous. And in 1920, the entire scientific community agreed, hey, all Heloderma lizards are venomous and no longer suspected. So what about the venom delivery? So they have a multi-lobed venom gland on their lower jaw. These venom drain through ducts associated with each lobe. And this is very different than snakes. So snakes have a very advanced venom delivery system. This one is somewhat simple. Their venom gland is not surrounded by compressor muscles, again, like venomous snakes. So when a Gila monster bites, it takes the movement or the pressure of this jaw and the biting of it to excrete the venom into the oral cavity. The teeth have special, what they call venom conducting teeth, or grooves within them that help pull this venom into the wound via capillary action, along with just the traumatic injury that these teeth can cause. And that's what causes the envenomation. Whereas snakes have a much more advanced process. So this is a drawing from a book I got. I don't have any financial gain from this. It's just an excellent textbook on Gila monsters and beaded lizards, but this has a good picture of the 4 lobes on the lower jaw. There's one on either side of the lower jaw. These little black dots are the venom ducts that are associated with each lobe, and they're associated with 4, 5, 6, and 7 teeth on either side of the lower jaw. Again, the animal needs to bite, kind of hold on, and just the movement causes this venom to excrete and then be absorbed into the wound, so to speak. Very different than rattlesnakes, which most people have heard of. Their venom gland is in their upper jaw behind their eye. They do have muscles that compress that venom, so it can move down a venom duct out a very advanced thing that's retractable, folds out. They can inject it, squirt it, and have an envenomation within a fraction of a second, where again, our Gila monsters take some time. You can feel the effects of a Gila monster bite within seconds, but to have a fairly severe bite, normally it takes longer than that. This is a transverse image of that venom gland, and there's no musculature at all around this. This is the venom duct. This is just, again, from the animal physically holding on to either a coyote or a human in this case, or in some cases, and have this venom ooze out around these teeth. And this is a drawing or a cartoon figure of that tooth with a venom groove. They say this helps move the venom into the wound via capillary action. It may also just help damage the tissue of the defensive bite as well. So in either way, it just helps venom enter the wound a little easier. Research on the venom, this is really cool. I don't want to get too sidetracked, but I will talk quite extensively on this to a point. It started back in the 1800s. They found possible toxins. But again, it wasn't until 1913 where Loeb did venom biochemistry effects on physiological systems in different organisms. This is the one that really was definitive. It showed, hey, this is a venomous reptile. In the 60s, it showed serotonin, hyaluronidase, phospholipase A's, and some other active components. In the 80s and 90s, it got into the enzymatic activity and the bioactive venom components. This is really cool. This is the start of drug discovery, specifically in the early 90s from our local monster, so the Gila monster. Exendin or exenatide was isolated, and I'll kind of touch a little bit more on that in a minute. But to talk a little bit about the interesting part of Loeb, it's back in 1913. So he tested hundreds of species. He looked at invertebrates, ectotherms, and vertebrates. He found that invertebrates were basically immune to Gila monster venom. Ectotherms, which are lizards, amphibians, reptiles, amphibians, fish, very minimal effects. Invertebrates, it can be severe and buried. And this is really cool when you think or know a little bit more about the animal. So Gila monster's venom is for defense only. It does not have anything to do with subduing prey. They're considered nest raiders, meaning they just go out and forage for animals and eat quail eggs that are on the ground, possibly climb into burrows of rodents and eat baby mice, baby rats, etc. But they cannot catch any of these rapid moving animals, and their venom is not used to subdue the prey. So they also don't feed on invertebrates like arthropods. So centipedes, scorpions, spiders, their venom has no effect on that because they don't have any reason to be defensive against these animals. Ectotherms like lizards and snakes, minimal. Again, these animals don't feed on them for one thing, and they also aren't too worried about them having any effect on them. But vertebrates is different. So we're thinking badgers, foxes, bobcats, humans. All of these can have detrimental effects to a Gila monster, so their venom is in defense. So that's where it has most of its effect. It's just really cool. And this is all the way back in 1913, right? The LD50s is comparable to the Western Diamondback or Crotalus atrox. Remember, the lower the number, the more toxic the animal is. It's quite varied in these studies, but Russell, he was from here in the U of A, back in 81, did some of these and showed it was comparable to C. atrox. Again, the venom delivery system is very different, but the venom overall is comparable. And then in mammals, non-human, it can cause respiratory issues, cardiovascular, hemorrhage, blood, edema, among others. So what about the venom constituents? This part I really like. The one on the left is myself and a buddy of mine, Mike. We're collecting venom for a study we're doing. You can really see the osteoclasts on the head of this animal here. So this is a Gila monster. This lower jaw, this kind of lobe part, this is where the venom glands are. And it takes a while for that to ooze into the oral cavity. So we have them chew on this rubber tube, and then this is the actual venom dripping off. And this takes, 30 seconds to a few minutes to collect any venom from this. We collect it in Eppendorf tubes. centrifuge it, lyophilize or desiccate it, and then run HPLCs on it. But it takes some time, unlike a rattlesnake where when it bites, you've probably seen some of these videos, within a second, you get a large quantity of venom dispersed into a container or into its prey or into a human, which is very different for these animals. The one on the right is one that we hatched out. So this is fresh out of the egg, ready to go, and he can definitely envenomate.
How big are the newborns?
I have some pictures I'll show you. So these are some of the more recognizable aspects of their venom. So hyaluronidase, it's very common in bees, hornets, spiders, snakes, kind of across a lot of the venomous animal world. There's hyaluronidase. It's nicknamed the spreading factor because it breaks up the hyaluronic acid, which is all throughout the tissue. There's serotonin. We all think about a neurotransmitter, but these are also found in toads, hornets, wasps, and whatnot. In the local area of an envenomation of a bite, you get a lot of inflammation, vasodilation, probably pain associated with that as well. There's phospholipase A2. I'm going to skip over a lot of these. Nerve growth factors, helothermin. This one's kind of cool because of the name. It actually lowered body temperature of some of the lab animals, so helothermin, interesting. I love showing pictures of animals. So this is a rescue animal my wife actually rescued from a construction site. We were contacted by Phoenix Herpetological Society and Game and Fish and rescued this animal. And a couple days later, she laid eggs. So these are the eggs of her, and this one in the center is fresh after, and you can see the embryo attached here. The one to the right is several weeks later, but you can see the vasculature and the embryo growing, so that's pretty cool on that. Then we're going to talk a little bit on kallikrein-like toxins. These are serine proteases, SPs. These are really make up the large majority of the venom constituents. There's 4 different types. These cause a lot of pain. You'll notice there's a lot of things that cause pain in these bites. Hypotensive hormones, powerful local effects. They cleave kinogens that release bradykinins. Again, we have bradykinins naturally in our circulatory system, but locally in large amounts, it causes a lot of pain, a lot of inflammation, vasodilation, edema, a lot of these repetitive things that for a defensive bite are very important. So of these 4 different types, there's helotoxin named after our Gila monster. There's hortum toxin. This is named after one south of the border, Heloderma hortum. This one's interesting because it's the only one that has a hemorrhagic potential to it. We don't see hemorrhage in the envenomations, at least not in the United States from these animals, but it is a potential for drug discovery or more research. So that's a pretty interesting one. We have some non-lethal ones. We have helodermatin, another interesting one from the Heloderma south of the border, dose-dependent decrease in arterial blood pressure. So we get a lot of hypotension in our envenomations, but again, another area for drug discovery, right? So here's some babies. So these guys are just popping out of the eggs. This is my hand here, so I don't know, that animal's probably, what, 8 inches or so. And that's fresh out of the egg, so they can really cram themselves in there. Right when I set him down into this little container, he's ready to pop, ready to go. So I'm very careful, but they are ready to go. We took pictures of all of them and named them, give them numbers. All of these images, their patterns are like fingerprints. So you can ID these later on in life, even as adults. These were all donated to Phoenix Herpetological Society, and these were then given out to other museums and zoos across the nation. So it was pretty cool. Again, this is all through Arizona Poison Center, Game and Fish, the whole 9 yards, but it was really fun. All right, then we get into some of the really interesting stuff, the bioactive peptides. It started in the 80s and 90s, but the 80s, they noticed that the Heloderma lizards cause secretory response from our pancreas. This was similar to the VIPs or vasoactive intestinal peptides. In humans, it's an endogenous peptide, causes smooth muscle, mediates secretion of water, electrolytes from the small intestines, among some other things. And in the 90s, they isolated some of these from the Heloderma venom. So Heloderma suspectum, that's our local monster, right? That's our actual Gila monster here. Found it had endocrine actions and it was a GLP-1 type agonist, or antagonist. So I'll discuss that a little bit more here in a second. So there's 5 different types. There's extended 1, extended 2. I always stop when it has a interesting effect. So this one in dogs showed prolonged systemic hypotension. In rats, dose-dependent hypotension via potassium channels. Interesting area for more research. But again, hypotension, pain, all these issues that we're going to see with other bites. Extended 3. And then the really cool one is exenatide. So this was the one that was identified in the early 90s. This is induces insulin release through activation of a glucagon-like peptide receptor. Some of us are familiar with this drug that came out of this research. It's called exenatide, right after the name of the venom component. It also goes by the name Byetta. What was really cool is during this time, there was 2 studies going on. One was on human GI tract where they actually isolated the GLP-1, and they were using this in a study for diabetes. The problem was from humans, the half-life's about 2 minutes. And they did a study that lasted 6 weeks where they did a continuous infusion in patients with GLP-1 from humans. Another arm of it had subcutaneous injections, but they were multiple times a day. But at the end of 6 weeks, it showed excellent potential to help regulate diabetes. Awesome, right? The problem is in a chronic disease, there's not much you can do with a continuous infusion, right? But at the same time, they're doing Gila monster venom research. And wow, here's exenatide. Does basically the same thing, and the half-life's 2.4 hours, I think it was. So 2.5 hours. Awesome, boom. Right into the drug era we came, and that's where we got the first medication that came specifically from Gila monsters. And what's really cool about exenatide is it is a glucose-dependent, causes insulin secretion, but it's glucose-dependent, meaning it's very difficult to become hypoglycemic when you're taking this medication. Has other issues like cardioprotective. So this is also, this class of drug is one of the main ones recommended for diabetics with any type of cardiovascular issue, right? So although exenatide or Byetta, I don't know if my fellow pharmacists here, we don't see that much, right? But we see other GLP-1s out, and they're really becoming a blockbuster based on this and the cardioprotective effects of it in helping diabetes. So super cool research that came out of it. And then there's Helatide. This is the last of them. This one's interesting because it improves memory in rodents. There's active research for Alzheimer's as well as ADHD for this peptide as well. So a lot of ongoing research. Little cartoon figure just to remember and remind everybody with any envenomation, all these effects kind of overlap, right? It's never just one component. It's multiple different components of venom that may be causing similar issues, but they all overlap and cause pain from several different sources, vasodilation, edema, et cetera. So that's just a reminder. And that's with basically any envenomation from rattlesnakes to Heloderma. So what happens to a lot of these? Unfortunately, in the wild, this one on the left, my wife rescued this one. So this one was saved. This stuck in a couple glue traps. These glue traps are very strong. I've seen tortoises killed in them, snakes, Gila monsters, birds. They're very indiscriminatory. Very difficult to get these animals off, and a lot of them will actually pull themselves off, rip the skin off, expose muscle tissue and whatnot, and die of infection. So they're pretty rough, but this one was saved. And then the one on the right is what we call DOR, or dead on road. When we're out looking for some of these animals, you'll come across a lot of these like this. But they're not all bad. So this one on the right is called Peggy. This is one that we show at the Arizona Poison and Drug Information Center on a regular basis. This animal had its arm caught in a rat trap. It was damaged so bad it had to be amputated. This gentleman on the left is Dr. Jim Jarko. He's one of our vets from the past. Awesome individual. He rescued this animal, actually donated it to the Arizona Poison Center many, many years ago, and we still have it. Actually brought her with us here. If you were here, you'd be able to see her. But very cool animal, so there are some good endings to some of these.
So you mentioned, what's the average lifespan?
The average lifespan of Heloderma, there's some at the Arizona Desert Museum that are probably 40 plus years old. Yeah. So very long. So let's talk real quick about envenomations. Most can be avoided. I should have capitalized most and wrote it about 3 different times because most can be avoided. I'm going to say that repetitively. There is no antivenom for Gila monsters, unlike rattlesnakes. It's just symptomatic treatment, but some of these symptoms can be quite severe. So let sleeping dogs lie. I always throw this in there, let sleeping Gilas lie. There's a lot of case reports of people who have been envenomated by their animal at home because they think it's dead. So this is Peggy. You can see she's missing her little arm here, little arm there, and her little arm here. And this is how she sleeps in her enclosures a lot. You can see this looks like an animal that's passed. You reach in there, grab it, she turns around and pops you. So just let sleeping Gilas lie. Kind of cool. Here they are in the water bowl again. They'll lay like this for hours and hours, if not a day or more. And you just think, what the hell is going on with my animal, right? The very cool osteoclasts and beaded look of their skin is really cool. So let's talk about a quick study they did at the Arizona Poison Center. This is quite a few years back, but they looked at Gila monsters and Envenomations, a descriptive analysis of calls to the United States Poison Centers with a focus on the Arizona cases. This was done by Robert French. He's an ED physician here at Banner University Medical Center, along with some other areas. Mazda Shirazi, the director of the Poison Center. Frank Walter, some familiar names if you're over here in the Banner world. So this was a retrospective review, looked at envenomations between January of 2000 and October of 2011. So what, a 10, 11-year period using the Arizona Poison Control Database. And these are the months where the envenomations happened. You notice every single month has at least one envenomation. And what I always like to point out is you see these peaks here in April and May. So everybody thinks reptiles love the heat. Like the hotter it is, the more you're going to see them. And that's not really true. Reptiles, snakes, lizards, they like the same temperatures humans do. They like the upper 70s. They like the 80s. When we're active, they're active. So April and May, when are most people out hiking around and most active? Those are the 2 months. That's when you're going to see a lot of envenomations, whether it be snakes or these lizards. At least that's my 2 cents on it. Again, it gets really hot, activity decreases, the rains hit, and then the winter comes on. So it kind of makes sense when you see some of these data points like this. They looked at 2 separate Arizona Poison Centers. The one on the left is the one here in Tucson, of course, Arizona Poison and Drug Information Center, attached to our College of Pharmacy. And then the other is Banner Good Sam up in Phoenix. The Tucson Poison Center looks at the entire state of Arizona except for Maricopa County. And Good Sam up in Phoenix looks at just Maricopa County. So you can see there's a lot of these envenomations, including dogs and cats. Tucson's a little more rural, so there was 1 cow in there. I think that's interesting. And then we get down to, okay, here, finally, these are human envenomations, right? 1 was reported to each poison center, so that leaves 70 unique bites. So where were these bites? Well, you can see right up top, hand, finger, and thumb. 46 of these were there. I told you most of these are preventable. These animals are very difficult to be bit by. They are not like a rattlesnake where if you get within a short distance, they can actually strike out and bite if they're startled or they're fearful. These animals, you physically have to put your hand on their head to bite. They can't lunge. They won't chase you. They don't jump at you. You physically have to put your hand in their mouth to get bit or pick them up. So again, these 46, in my opinion, preventable. The only legitimate ones on here are probably these foot and heel. If somebody is out walking, say they're taking garbage out at night or early morning and an animal's out, they don't see it and they step on it, it'll turn around and bite again because you're physically putting pressure on the animal and it's defending itself. So there's probably some legit bites in here, but very few. This out of 10 or 11 years, we're talking 1, maybe 2 legitimate envenomations. The rest, preventable. I can't stress that enough, preventable. So any guesses? There's always a joke about rattlesnakes. And it's always a joke about guys with tattoos. Hello, you can see me here. And testosterone. And that doesn't hold true with snakes. With rattlesnakes, most people who are envenomated are gardeners. And they're usually elderly. They're in their 40s, 50s, and 60s, and they're being envenomated. So it's not from people messing with these animals. But in Gila monsters, over 80% had a Y chromosome. Again, these are animals you have to put your hand on in their mouth to be bit. Over 80% involve the upper extremity, probably the hands, the Y chromosomes, right? There were some under 18, there were some work-related ones. 28 were evaluated at a healthcare facility, but not admitted. 11 admitted to the hospital, 5 to the ICU, 3 required emergent air management. So this is really interesting because this is a symptomatic treatment, but as you'll see and we'll talk, anaphylactic reactions are probably what we're more concerned with. And that's probably what these intubations had to do with. And no deaths were noted. So these are the effects that were reported on the left in the red by the patient, on the right in the blue in the EMR. Pain was number 1. That's the bold one reported by the patient. And this makes sense. A lot of those components we were talking about, serotonin, kallikrein-like enzymes, serine proteases, these all end up causing pain. So that's kind of the number 1 aspect there. But you'll see some other aspects too, numbness, nausea, etc., abdominal cramps. In the EMR, you see edema. Makes sense. Again, a lot of these components we talked about are causing vasodilation. They're causing tissue spreading factors and edema in that part. But we also see hyper and hypotension, vomiting, incontinence, fecal incontinence, urine, diaphoresis. Think about anaphylaxis. It's not just stricture of the airway. There's a lot of other components that are involved with anaphylaxis. So some of these more severe envenomations are probably due to the anaphylaxis component, not necessarily the local effects. Here's some interesting cases that I pulled out of it. So they're all males, go figure. The first one is a 36-year-old male, bit on the hand, documented the incident on a video, and the bite lasted 42 seconds and required intubation. Now, 42 seconds, think about this. Look at a clock, get an animal that bites you. It cannot inject venom quickly like a rattlesnake, but you can still feel the effects within seconds. And this animal held on for 42 seconds. That's a pretty extensive bite and a lot of time for this venom to absorb. And look what happened. He required intubation. A 26-year-old got bit on the neck and finger. So he had a Gila monster on his shoulder, probably trying to take a picture, right? So very preventable. It fell to the floor. That's going to just piss off an animal, right? He picks it up, puts it on a hat, and it bites him through the hat on the fingers. So he got nailed twice. Tongue swollen, difficulty swallowing and breathing. Again, what did I say? This is preventable, right? The next one, 46-year-old male, bit on the neck. No description, but bit on the neck. I mean, this is impossible unless you're taking a picture with the animal. Required intubation. 29-year-old male, stated the Gila monster was moving towards his girlfriend. So he had to place his arm between them to protect him. I mean, you know, it might sound interesting, but let's just face it, that was probably not what happened. These animals do not want to harm us. They don't chase us. In either case, he was diaphoretic. His entire arm was emetous, had airway issues, etc. So these are all preventable envenomations, but they are pretty significant. So what about the females involved in these? I love this part because the top 2 are just awesome. The first is a 26-year-old female researcher bitten through protective gear. So she's out there for the better of the animal, which, you know, that just really makes my heart warm and fuzzy. I love these animals. And she was bit through protective gear, but you notice she wasn't intubated. A 45-year-old female at a zoo performing a procedure was bit on the hand. Again, trying to better the animal, bit on the hand. No big issue. The lower one, 49-year-old bitten on the finger while removing from another individual. I could put money on it was probably her boyfriend. I don't know that for sure, but probably somebody with a Y chromosome, right? So again, in conclusion on these, they're kallikrein-like toxins. These hydrolyze kinogen and produce bradykinin locally in large amounts. This is what really affects the patient and feel the pain. Causes local edema, including airway strictures, can be delayed, hypotension, etc. And this, again, is a defensive bite, right? So if you're a badger, a coyote, a bobcat, or a human, you get bit by this, you're going to remember it. So it's not necessarily to subdue or kill something. It's for, you know, defensive, to remember it by. Gila monster bites, about 15 to 16% were admitted to the hospital. 4% required emergent airway management. That is massive when you think about envenomations. Rattlesnake envenomations, I don't have the number, but it's probably 0.0 something, 0.00 something. We have about 180 Envenomations through our poison center here, probably another 80 or so a year up in Phoenix. And rarely do you see Envenomations, once every 10 years or so. I mean, it's just not seen. Whereas with Gila monsters, although the envenomation is rare, the potential for it to be severe is pretty significant. And that's where you really want to watch for these issues, right? Nationally, Gila bites, about 24% admitted to the hospital. Gila bites are very uncommon. They can be managed through the Arizona Poison Center or the ED and not admitted to the hospital. But again, if you are EMT or you're coming up on a patient that was bit by a Gila monster, you can expect the pain, you can expect the swelling, the typical aspects of trauma and a painful envenomation. But what you probably want to watch for are these anaphylactic type issues. If there's a lot of vomiting, that's a big deal. If there's hypotension, if you're passing out, I mean, these are things that could potentially lead to something much, much more severe. So that's what you probably want to be watching more for. As you can see here, edema of the airway was infrequent, but potentially life-threatening, about 4%. This paper said consider about 12 hours observation. I personally think that's a little too much, but it's probably a case-by-case basis, you know, maybe 4 to 6 hours. I'd say call your local poison center. They can help with these envenomations. But if they are showing vomiting, diarrhea, incontinence, low blood pressure, you know, these issues that can lead to something, obviously with any type of airway issues, they do need to be seen in the hospital. Otherwise, you know, give your poison center a call. This is one last reminder to show, some people probably have heard this earlier in the year. In February, a gentleman did die from a pet Gila monster. This was in Colorado. I should have put the website down. I think this was CNN or a local place in Colorado, but this is just a Google search all over the web. A 34-year-old man, he got bit by his pet Gila monster. Per his girlfriend, the lizard bit his hand and lasted on for 4 minutes. Now, again, we talked about that other one with 42 seconds. And he was intubated, this one with 4 minutes. She also stated that he immediately started vomiting and he passed out several times before they called 911 2 hours later. Again, this is probably a gentleman who was fairly comfortable around reptiles and new reptiles, but didn't know anything about envenomations and the potential of anaphylactic complications or just complications secondary to an envenomation, period. And this more than likely could have been prevented. But unfortunately, he died 4 days later. This was only the first bite since 1930 that caused a fatality. So again, extremely rare and preventable. I mean, that's the best I could say. So that's kind of the end of my talk. I don't really like to end on something so negative. So I'm going to throw in wall art here in Tucson. Anybody who's around Tucson knows we have very cool wall art. This is from Euclid and Grant. I think I misspelled Grant there, but Grant. But pretty cool, Gila monster and a buddy ant there, right? But we have wall art all around Tucson. So enjoy. But yeah, that's it.
All right. Let me go ahead and stop sharing here so we can pull up if we've got any questions in the chat.
Yeah, no, Dan, thank you for a fantastic presentation. And I think what we'll do in order to give Larry some time here, we'll just move on to his presentation. And you folks at home or wherever you are at work, just put it in the chat box. I can tell you Melanie will get an answer for you one way or the other. Either we'll do it after Larry speaks and open it up to the whole, both topics or whatever it takes. Okay, so Larry, you're going to talk about ayahuasca.
All right. So thanks to Dan, I'm glad we could get some people that really knew what they were talking about. For ayahuasca, we could not get any of those today. So I'm going to do my best to get through this. I'm going to try to get through it a bit more quickly so we can leave some more time for questions. Let me make sure. Okay, so nothing has popped up yet. All right, let me steal this bad boy. There, I just had to believe. All right, so let's set it up for a quick case. Now, I will admit, this is a more extreme one for what we're about to talk about. But this was a 40-year-old female. She was going out with her friend to a weekend ayahuasca retreat. So typically ayahuasca, like many of the things we've talked about, especially recently, I think of this a lot like I do peyote. It's typically oriented around a ceremony. In this case, sort of a purification ceremony and inner healing that individuals typically will seek this out. Now, for what we'll talk about, I want to point out at the beginning here that this individual has no known past medical history, not even family history, of any mental health issues. She does endorse, I did some cannabis in the years past, don't really do it anymore. And about probably the past year, she had tried MDMA, given it a try, and not really experienced any ill effects from it. So during this retreat, she consumed ayahuasca a couple of times. That is not even the right computer. There we go. So after effects here. So she consumed ayahuasca on a Friday, no obvious issues. And this seems to be echoed by some folks. You may take it, nothing happens to you. You don't even notice adverse effects of it. All through Saturday, totally normal behavior, a-okay. Now, prior to ingesting it Sunday, and she has not taken a second dose. This was about 20, 30 minutes before the ceremony. Then she started with incoherent discourse, as her friend described. Much more manic, really started to get animated. Still took the second dose. Paranoia and delusions occurred 15 to 20 minutes after ingestion, which keep that time point in mind too. That is unusual with how quickly ayahuasca gets going. Now, after that, she remained in this state for the next 24 hours, and it devolved as time went on, bringing up past traumas, very manic, no sleep, constantly speaking. All right, so we'll come back to it at the end. I hope I've wet the whistle for what this one is. It's a very unusual one. So ayahuasca, at least on the surface, is very similar to other stuff we've talked about. I mentioned in terms of peyote, even datura, there's ceremonies where folks will use that herb in their ceremonies. This one is unique in that it primarily is used more in South American Amazonian groups. Now, who knows when this actually was honestly taken up? There's really not great information about that. We know that folks in this region were using different substances even 2,000 years ago, but it's not clear when ayahuasca really started to be incorporated. The first reports we really have are folks visiting the area in maybe the 1700s, where they started to write about it. It is felt that probably these different combinations evolved as communication between tribes increased, and we got sort of a hybrid that ended up being ayahuasca. But I think the other unique thing about it is that it's a term that really comprises different recipes. So depending on the region you go, the person preparing it, you can get a very different combination of botanicals that go in to make this what it is. The skill of the person making it, how they do it, can absolutely alter the kinetics of the drugs in there, the exposure, even what's actually available, depending on what they pick. All right, so making ayahuasca, there's a couple of products that we tend to think of that are classic ayahuasca. So Banisteriopsis caapi is a vine. Typically parts of this are taken, they're macerated, and they're boiled. And here you see probably Banisteriopsis caapi. And I say probably because, again, several different roots or vines can be used to actually make this. The interesting component, at least the more active thing that we're going to talk about, typically comes from Psychotria viridis. Now, the recipes are all over the place, typically if prepared more as part of a ceremony. They may be boiled separately. Typically, folks are watching to see about half that water boiled down. They may combine it. It's not a fast process. This may take over a day for someone to actually produce the final thing. So what is really happening, so if you were with us for our first webinar, we talked about Colorado river toads. We're going to see the same thing come back up here. Psychotria viridis in the leaves that are used. A number of different things, bufotenin, similar to what we saw with that, but DMT, dimethyltryptamine. So we had presentations from Dr. Shirazi on psilocybin, if you recall, way back when with DMT, all hallucinogenics. And you see similar effects. Potencies are dramatically different. DMT does not really quite have the kick that psilocybin does, not by a long shot. But it is something that we worry more about with ayahuasca or is present. So quick refresher on this one for the sake of time. Hits a number of serotonin receptors, a bunch of other things that may mediate some unusual stuff in terms of immune reactions that we won't get into today. But probably the 5-HT2A and honestly the 1A receptors are the ones that are mediating the biggest effects we'll talk about today. Now, if you remember from the Colorado River toad, the big issue there was it's not really orally active. So folks smoked the product that they got off of the toad. So the interesting thing here is, well, we're drinking this. Why is this going to be something that gives the same effect? The issue here is that DMT is just wiped out by monoamine oxidase, liver, gut, and a lot of different places. And that is where the Banisteriopsis copy comes into play. So the unique feature of this herb is it has harmine, harmaline, and THH or tetrahydroharmine. They're beta carbolines, but they function as MAO inhibitors. And their presence alone is what keeps DMT active. Now, we're not seeing massively increased times, but you are seeing these last for several hours if these products are taken together. Now, the final bullet point I waffled on, there's data out there that these as MAO inhibitors themselves can have psychoactive effects. That is debated, quite honestly. There's a number of different studies that argue maybe there's nothing to this. There's some where it appears that they did contribute something to these individuals. Now, these are all hopefully available for you. You can see them nicely if you're on the webinar. This comes from a massive study that came out a couple of years ago. It was literally an ayahuasca global survey. If you have taken ayahuasca, we got questions for you. We want to hear from you. So over 10, and that's the reported numbers. They had 10,836 people that have said, oh yeah, I did that at some point. And they all talked about their experiences. So a lot like peyote, you're gonna pay for this, most likely. So first things first, vomiting or nausea. And now I hate to waste the time on this, but the quotes that stuck out with me is people that describe this is not vomiting. This is a mega hurl, as if everything you have consumed since birth is explosively coming out of you. And it is in all of, there is one case that I didn't want to put it on here just because this was this guy's personal blog. But he described an incident where he went here in Tucson and actually took part in one of these ceremonies. And within half an hour, everyone's retching in buckets. I mean, it is a part of it that you go into it expecting that that's going to happen. But for a lot of these ceremonies, that's almost a part of it in terms of the purification that you're getting these toxins out. Outside of that, in terms of physical issues, I don't want to belabor this. The breathing difficulties, chest pain, this is likely related to folks that do have a history significant for cardiac issues, ulcers, something along those lines. And we won't talk a lot about it. Those are the folks you probably do have to worry a bit more about if they are consuming ayahuasca. So duration of activity starts within 30 minutes, which unusual timing with our initial patient case. Who knows if this was really the initial dose getting going, which again is unusual in and of itself. We would expect most of this to be gone, but it persists for about 4 to 6 hours. Now, why I've got most mental health symptoms is, again, DMT, we can see a lot of psychoses with this, a lot of out-of-body experience, visual, spatial hallucinations that are occurring. Just because the drugs have worked their way out of the body does not mean the effects stop. So many folks report, oh yeah, this continued on for days. And maybe within a week, then everything seemed to go away. And that seems to work well for folks that also report positive benefits. So in that same blog, the individual was looking to cure his depression or help him manage it. And he did report that this helped, but after about a week, it seemed like the depression had returned. And I think the conflicting thing here too is how much of this is really going on from the drug. Is it lit something up that's already going on in the patient? That's always, I think, the question, is what's really going on in the underlying circumstances for the patient. All right, so mental effects, a large number of folks reported a number of these different symptoms. So a number of things that can happen, feeling disconnected or alone. Boiling this down to folks that take DMT, psilocybin, it's probably going to be a trip, and I don't know if it's going to come out a good way or a bad way, but it can go a real bad way for some of these individuals. Now, risk factors, this is interesting too, and a little bit of variation depending on the study, but I tend to put a lot of stock in this enormous study that was published a couple of years ago. Certainly folks who are older, when they start trying ayahuasca are probably more likely to have these adverse effects. Lifetime use was positively connected. We had some borderline use here with some history of mental health. It wasn't significant here. Other studies have argued that yes, it does seem like there is something if there is a history. Substance use disorder was right on that line of significance. That is another one that in other studies has been linked, but I think folks outside of these religious ceremonies will combine it with other products. And that's one of the key points we'll get to is you don't necessarily know that this is the only thing the individual has consumed. There are cases where folks will mix it with other things when they use it. But in terms of the religious context, typically ayahuasca is what we're seeing used. And folks in the religious context, to be fair, in and out of this study, more report that if it's in the supervised traditional setting, seems to be less risk of these issues presenting themselves. Still happened, but less risk. Now, as far as fatalities go, this is thankfully very rare. And issues like we talked about way back when with something like DMT or the bufotoxins, the details are hard to find. Now, these are what are typically reported in these studies, probably folks with cardiac issues, other substance use. But when you actually read the cases, I am not so sure. I would suspect, yes, cardiac issues. I think one of the main issues is the drug-drug interactions. You get folks coming on drugs that will, of course, interact with MAO inhibitors. And that alone could be the main issue that you're running into, not necessarily the product that you're consuming. I saw one case that was an allergic reaction, another that was an overdose, which based on studies takes a fair amount to get to that point. But why that's tricky to really nail down too is you don't necessarily know what the formulation of that ayahuasca was. And the issue is that DMT gets out of your system so dang fast, it's even hard to link. Is this really what we think it was at this point? All right, so adverse management for the folks watching. You're probably going to be worried more about the psychoses that are going to develop, and these can be lingering in these individuals. So management, I think, be aware of other substance use that could be confounding this. In terms of the psychotic presentations, it runs the whole gamut. There's individuals with delusions of grandeur. It covers all of the bases in terms of what you might get. Benzos were used in some cases. I think just be aware, depending on that past medical history of mental health issues you may run into, they're even exacerbating pre-existing problems. Antipsychotic use was done almost every time with a lot of these individuals. Quetiapine, olanzapine, risperidone. Risperidone used surprisingly a lot in this circumstance for these individuals. Now, the question I couldn't get a solid answer on is, what was the duration that these folks were treated for? And it's hard to really nail that down, but in most cases, a couple of months before you really started to peel back. So I don't know if that's, do you need 2 months or did you let it go for a while before you even considered messing with this? All right, this just came out last month. The federal settlement will allow Arizona Church to import, process, and use ayahuasca. So it is something that is here. I think this is the Church of the Eagle and Condor that got this approval to use this. Now, going back to our case, fortunately, a psychologist was attending this retreat and recommended 2 milligrams of risperidone. And within 30 minutes,
that he had with.
You will be interested, yes, because that detail is left out, but access did seem surprisingly fast. You'll notice the hospitalization, which is coming, is days later. So interesting. I don't know what's happening there. Why you have to always worry there's other things being used here, you never know. So symptoms resolved, 48 hours of wakefulness, slept for 7. Woke up, everything was just as it was. Psychotic symptoms had returned. This time, after 2 days, finally someone decided, yeah, we probably need to take you to the hospital. This doesn't seem like it's gonna get much better. Haloperidol was administered. Patient did improve very quickly. I think what's of interest to me, and we don't have solid answers, is why a lot of these effects persist. Now, the friend in this case did say that she started talking about a lot of trauma in her past, bringing that up, maybe even things she had forgotten or repressed. Is it really lighting a match to another psychological condition, totally absent of the drugs? I think that's a fair question. Is you're dealing with maybe something else at this point, not necessarily the ayahuasca. All right, so in summary, for the sake of time, this is probably the best summary slide I've ever seen in my life. And of course, I had nothing to do with it. So this is from a great study here that talks all about the kinetic dynamic aspects of ayahuasca, summarizes everything that we talked about here and a little bit more. So in conclusion, I think ayahuasca really stands out because it's a unique combination of stuff we've talked about in finding a way to amp up that activity and make it last a bit longer and make it orally available. Different formulations, who really knows what you're going to get with some of these products. There is, of course, interest in using it therapeutically. I think the DMT component, similar to how folks now may go to ketamine clinics, can these things be used to cure some of these psychological issues? The adverse effects, primarily psychological, but folks maybe with ulcerations, esophagitis, cardiac issues. I think the biggest issue too, of course, for pharmacists, but drug-drug interactions that can unexpectedly be there as a result of this, and really toxicity from something else. So if this is suspected, do consider what else the patient is on. All right, and that wraps it up for me. All right, let me give it back to you. Let me put this away.
Thank you, Larry.
You are most welcome.
Well, it sounds like the one thing we want to avoid is vomiting in both problems here.
In both cases, I agree.
Surprising how much hallucinogenics and violent vomiting seem to go together. Part of the trend.
Okay. Well, you know, both of you presented a great topic, and I'm sure there are questions. We often have them afterwards, and Melanie will make sure that they go to the right people for sure. And Dan, we'll have to have you back to think of another topic for you.
Yeah, please. We could do rattlesnakes. We could do Gila monsters. We could do scorpions. Got all kinds of good stuff.
All right. Well, we've done rattlesnakes, but we haven't done the treatment part. That's coming up. But we had how to avoid it at least an hour's worth. That was really good. That was
Yeah. A lot of I'm sure some people at the center were involved with that because Arizona Poison Center, they're the ones to talk to on that.
Oh, well, you know, Mazda is one of our founders of this topic or this course. And so he hasn't lectured since last month. We'll get him busy. Okay, so I think we should probably just end it here. We're at 2:58, and thank both of you so much for your topics and the great preparation you did. And once again, I'd like to thank Melanie and Chris, who without them, we would have nothing. So thank you both.
Awesome.
All right, thank you everybody for joining us. I will be sending out an email a little bit later this afternoon. I'll have the link in there for the evaluation, and all of our EMS folks, you can also, once you do the evaluation, go ahead and email me back, and I'll get your certificates out to you as well. And we are coming up with our next topic, so be sure to watch your emails and go to our website and see what's coming up next. And again, thank you, Dr. Macy and Dr. York and Dr. Klotz. Again, another fun session, and I don't know if you folks at home can see, but there are a couple of buckets sitting behind here with some yellow caution signs on them of feminist reptiles. So
Exhibits over.
we're going to be seeing some exhibits here pretty soon. Anyways, again, thank you for joining us, and we look forward to seeing you on our next time. Thanks, everyone.
Melanie, how soon will these be available on the archive?
Later this afternoon, usually once it gets processed, and then we'll have it up on the website. And in the email, I will have that link on where to find that as well.
Well, a lot of people may want to send their friends to take a look at this.
And again, the whole series is on our website. Thank you, Chris, for posting that into the chat right now. That is the link for our previous webinars, where you can find some of the other very entertaining and informative webinars that we've done with this series. All right, thanks again, everybody.
Bye.
Hey, guys.
Bye, have a good one.